Hey everyone, thanks for tuning in. We just recorded a very informative episode of Recovery TV Live with special guest Derek Thomason, where we address this question of what is EMDR. So there's more on that coming up, so stay with me. Welcome to Recovery TV Live. We're going to talk to you today about eye movement desensitization reprocessing. We have a special guest with us here today. We're going to talk about him in just a minute and let him really kind of go into all the details of what EMDR is. If you're watching this on YouTube, please go check out our Facebook page and join us live on Facebook, and I'll put that right there for you so you can see that. So this is a really special episode for us because Green Shoe Foundation has partnered with us, and you can go check their website out at greenshoe.org. And it's a really appropriate episode because we're focusing on trauma treatment today, and they do IOP, which stands for Intensive Outpatient Treatment.
Right. And the Green Shoe Foundation is fantastic because they've really invested in being accessible. And so a lot of people have barriers to getting therapy, to getting treatment, time, money, availability being very common ones. And the Green Shoe Foundation addresses each of those. And they really do work on the hard stuff. They focus on helping people with trauma. And that's what we're talking about today, is how do you treat trauma? There's many ways to do it, right? And Green Shoe has created some really good programs to really thoroughly help people work on their trauma issues. Okay,
So check that out.
Right, check it out. To have a service like that available to get that level of treatment, it's hard to find, and so we're really glad that they partnered with us.
Right. But today we're really excited to have Derek Thomason with us today. And Derek, you're a licensed professional counselor, but you're also what we call EMDR certified.
Right.
And EMDR is a form of trauma treatment called eye movement desensitization and reprocess, which I often say that's a mouthful.
Yes.
It is a mouthful, right?
EMDR is much easier.
Right.
Yeah.
It's much easier.
Yeah. That's why they abbreviate.
Right.
Yeah.
Right.
So just kind of in a nutshell, tell us just a little bit when people hear the eye movement desensitization and reprocessing, what exactly is that?
Right.
Sure. Yeah, it's a very unique therapy technique. It's not your standard talk therapy, which is one of the bonuses of it. It really focuses intentionally on the trauma that a person has dealt with. You pick a target and you go at that target until you have relieved some emotional distress from that target. So that's the entire goal of it, is to take the emotional distress level from debilitating in some cases to livable, manageable, and hopefully even to what we call a 0. We use the 0 to 10 scale to kind of measure that and get your feedback on how you're feeling as far as whatever that target is. So it's a really great way to deal with those traumas, and traumas can be so many different things. And I know a lot of people think trauma is you've been in war, or you've been in some kind of car accident or something like that, and that's all true. That's all trauma. But sometimes we don't think about the emotional trauma, the divorced family, the emotional abuse at home, neglect, things like that. Bullying at school at times can be, and so there's lots of different ways that we experience trauma. Even sometimes our own family of origin patterns can just become traumatic because it's been so much to endure, and it keeps you kind of locked into a constant state of fight, flight, or freeze. And that's really what we're looking for, is things that trigger that adrenaline and stress reaction, and you get frozen there so much, and finding relief from that. So
Right. So what I'm hearing you say is that when we use the word trauma, it doesn't have to be maybe your first instinct. If it's traumatic to you,
absolutely,
right?
Absolutely.
And you're having some kind of body response. You get panicked, you get nervous, you don't want to talk about it. Those are, and what I've noticed with my clients, that when I have those two categories of things happening, I think, EMDR would be a real helpful intervention for them.
Yeah, EMDR does great at targeting the emotion. It also does target those physical body sensations and things that you deal with. and helps reduce some of those things. So yeah, people experience those kinds of things, but then they say, oh, but what I went through wasn't really trauma. So
Right.
like you said, yeah, it's important to be aware of that. And trauma is kind of a subjective thing. If you've experienced it in a traumatic way, in a stress-inducing, anxiety-producing way, then that's trauma, and it doesn't really matter what anybody else thinks it is. So
That's right.
Yeah.
That's right. So, of course, a lot of people, when I make this recommendation, because I'm not trained in EMDR,
Right.
but I know how helpful it is and I understand the value of it. And so, can you explain how and why does it work?
yeah, sure. It's really interesting. The developer of EMDR, she wrote a book about all of this, which you have to read to go through the training. And she describes how she came up with it. Basically, she was having some kind of rough experience going on in her life. She went for a walk in the park and realized she was watching birds fly back and forth and just fly back and forth. And so she felt calmer, she felt relief from whatever the distress was. And so even just through something simple and everyday like that, she noticed that kind of a response. And so she took that and obviously theorized about it, worked on it, and figured out that our body's natural healing process for our brain and our natural place to process things and put things in place mentally is REM sleep, rapid eye movement sleep. And so that correlation is what they've found is really the key. In that rapid eye movement sleep, that's our brain and our body's attempt at coordinating the two sides of the brain. You hear people talk about, I'm a very left-brained or very right-brained person. Well, EMDR is all about let's integrate the two sides of the brain, put it all together, because trauma gets locked so much in the emotional side, it gets locked up in the feelings and the body sensations, and that's why we feel things and deal with things that we may not be able to put left-brained analytical words to, but we feel it, we know it's there, and so EMDR helps to put that together. I often describe it like having a big filing room and your files are just thrown all across the room. Rapid eye movement sleep puts those files in order, but when you've had trauma, you've got so much disorder and chaos that there's just not the ability to do that. So EMDR gives us a real life moment to kind of capture that and use that skill that's natural to us, that's inborn to us, and put it into practice. So.
And one thing I've told a lot of my clients is, like, look, fire departments, police departments, like, they really believe in this stuff.
Yeah.
If you
Right,
check out our
absolutely.
Facebook page, there was actually a guy who commented on that. He used to work in the police department. He's
Yeah.
like, we should send all our guys to that. It's super effective.
Yeah.
Right.
And so, yeah, talk about that just a minute. Like, do people say that? Like, it's kind of like, like, what is
Absolutely. Yeah, it feels very mystical, very very strange, because there's not a lot of real concrete things that even I do as a practitioner. I mean, I guide the eye movements, but for the most part, the client drives the process, and the client's brain drives the process, and we really just go with whatever a person's brain comes up with next, and just follow that thread. And so,
And so, are you sitting like this close to your client, and can you just demonstrate for me, just real quickly?
yeah, I mean, typically I would sit about like this, kind of offset, and then just hold my fingers
Right.
like this, and have them follow back and forth with their eyes. Some people have difficulty following with their eyes for whatever reason, and so we do have other techniques that we can use to
Like
kind of
the-
get that same bilateral
like the
stimulation.
light bar.
Some people have a light bar where the light bounces back and forth and kind of does the same thing. I've got headphones that have a tone that'll go back and forth to your ears.
Okay.
So it's not always about eye movements, although I do see when people use that, their eyes go back and forth. So it's really interesting.
Interesting.
Yeah.
I've tapped on people's knees before,
Okay.
or I also have pulsers, tappers is what we call them, and they kind of buzz or vibrate like a cell phone does, and it goes back and forth. And even with that, I see people's eyes go back and forth with it, and so it's getting that same left to right bilateral stimulation. The other thing is there's some everyday things that kind of mimic this. So I've had some clients that once they start EMDR, they're runners and they go running, and they realize that while they're running, suddenly they're processing things a lot differently. And if they're having a hard day, that turns into a processing moment, because it's all about left, right, left, right. So,
Oh, wow. Yeah.
so it's just, there's lots of different ways to achieve that, but similar result. So.
It sounds like, though, what I always say, and what I hope everyone can hear, is that this is really harnessing an organic, natural healing process.
Absolutely.
That's an amazing thing that our brain and body can do.
Absolutely.
It's not voodoo.
No,
It's
not at
science.
all. Absolutely.
Right?
Absolutely.
And that's
they
really
have
what we want to
research
talk about.
and yeah, they've done lots of research studies to show that it's effective, and yeah, it's all about capturing our natural healing process and just being able to instigate that in another way, because another thing that trauma victims typically struggle with is sleep. And so they may not even go into that rapid eye movement sleep level of sleep very often, if at all. And of course, people use sleep aid medications, which is fine, but most of those don't let you go to the deeper layers of sleep either. They just keep you asleep. And so this is an opportunity to have that without necessarily having the appropriate opportunity during sleep. So, yeah. Yep.
It's really neat. So I've had clients often talk about different physiological responses, whether it be like intense, even like anger, like emotional things, but also just physiologically, like just feeling their face heat up or feeling pressure rise from their stomach to their head, or what are some of the different physiological things you've experienced in working with clients?
Yeah, I think there's all of that. There's usually different kinds of tightness, or like tightness in the chest, butterflies in the stomach. Some people experience numbness, like in their fingers and toes when they really get worked up. Things like that. And so, so in the process of EMDR, one of the stages is to kind of do a body scan. Is there any uncomfortable or unusual body sensation? If so, focus on that, follow the fingers for another set, and just kind of see where it leads you. And a lot of times either the discomfort alleviates or it leads to some random thought that they might never have put with that body sensation. And so there's some exploration that can be done through focusing on those sensations as well. So it's kind of an interesting process. Your body's trying to tell you something. The body knows about trauma even before the brain can put words to it, because again, that right brain side, it's speaking. It just doesn't know how to use the words. So,
Yeah.
That's a good segue too. I'm going to put up on the screen here a quote from Carl Jung. He said, "There is no coming to consciousness without pain. People will do anything, no matter how absurd, in order to avoid facing their own soul. One does not become enlightened by imagining figures of light, but by making the darkness conscious."
Sure.
So
that's
does that kind of fit with what EMDR is about, diving into the painful center of the wound does?
Yeah, I think so. Yeah, I tell all my clients before we start that, it's true with any therapy, but especially EMDR, it's kind of intensive and things happen fast. And so things often get worse before they get better. So you're going to open up that wound, but I also compare it to being like a cancer. If you don't open up the part of the body to cut the cancer out, then it's just going to keep growing and growing until there's a bigger problem than what you had before. So I think that's absolutely right. And yeah, people do all kinds of, as the quote says, absurd things. I'll have people struggling with addiction come in my office and say, "I don't have any issues with my childhood trauma." Well, but you're living it out every day, and you're addictive acting out, and you struggle with alcohol, with drugs, with sex, with food, with whatever else. And so these are your
Depression,
mind's
anxiety.
attempts at, depression, anxiety, all of that. These are your brain's attempts at healing. It's just not working. And it's just not putting it together the way it needs to. So.
Well, and I like that you brought up those topics, because I think it's important for people to be able to understand why would you choose EMDR over other types of treatment.
Right. Yeah, and there's lots of great treatment options out there. I think one of the advantages is a lot of times what would take years of regular talk therapy can happen in a number of weeks or months with EMDR. It's just that intensive, and things just move that much smoother. And of course, that depends on a lot of different factors. There's no specific, this is how long it'll take you, because it depends on your situation. But I think some study that I saw said that there was significant improvement amongst like 90% within just 3 sessions. So that's 3 sessions of the actual eye movements and targeting and all that. So it's pretty great. You don't necessarily get that when you're just talking through your trauma. In some ways you relive it more so, but we also work on resources and setting up in your mind, safe places and different other things that can relieve some of that distress, so that while you're going through it, you have somewhere to find the comfort, the peace, and things that you need to be able to manage those emotions enough. So there's a lot of things within EMDR that are useful, and in addition to that, just positively installing some of the positive cognitions or positive beliefs about ourselves that so often we argue against, and we think, no, I'm not really worth anything, I'm not really good enough, I'm not really whatever. This helps to make those feel true. And so that's one of the stages of the treatment process as well.
Say that. Yeah. Josh, when have you recommended it for your clients?
Usually when I'm sensing like a trauma is driving, whatever they're coming in for, whatever I see that there's something in the history of what's going on that's really driving the disturbance. But I'll be honest with you, like I think that most people, like if you're 3 decades on this earth, you've had enough life experiences and seeing some of life's darkness that you probably can benefit from EMDR. And this is one thing I'm not afraid to disclose this. Like I've actually done the treatment, and I was a believer in it before because research backs it up.
Right.
You know, so I was referring clients for EMDR treatment long before I went and received it myself. But when I went and did it, man, I really became a believer. In it at that point, like, all the things that my clients were telling me about all the physiological responses and everything, I'm sitting there thinking about those things as I'm actually doing the treatment, because it's kind of a trip, and it can kind of be scary. Like a lot of clients, I don't know, did you have that experience where clients will tell you, like, I don't know if I want to go do it?
Yeah, absolutely.
Because it's kind of terrifying in some ways.
I hear that a lot, and you know, it's kind of explaining and understanding that the brain. Remember, I tell my clients this all the time. The brain has one function, and it's to keep you alive. And so if avoiding trauma keeps you alive, it's going to keep doing that. But usually you being in therapy, you sitting in my office means you can't avoid it anymore. So the best way to be alive is to go face it. And I usually don't recommend it for people unless they're at a safe enough place to do it. So if they're still experiencing trauma, if they're barely getting by, if they're having debilitating panic attacks, those kind of clinical issues, I don't send people for it. I also don't send people for it if I also think they're exhausted. Because like you, Josh, I have done EMDR in my life, and it was very helpful, but it is exhausting. I don't remember, honestly, how I got home after the first session. I know I did, but I don't really remember because I was so drained and spacey. But it felt okay. It felt therapeutic, like a good cry kind of feels. It feels similar to that. So I think what we're saying too is that this is a very helpful, but it's also, I think, a specified time to work in EMDR.
Yeah, definitely. And you have to work with somebody who knows when to apply that and when not to, for sure. And what you're talking about with the survival is that fight, flight, or freeze, which is perfectly normal. It's what we all do. But when you get locked into fight, flight, or freeze, those things become really unhelpful to life. There are moments where I can't just fight my way through. Otherwise, my job doesn't work out well. My wife doesn't enjoy it very much. My kids don't appreciate it, that sort of thing. So those modes are okay in the moment, but when you get trapped there, it's just too much. But when things are debilitating, when things are overwhelming to that extent, like you talked about, you definitely have to deal with some of those issues and find some safety and some resources before we can actually start the process of processing.
Let me put a quote up here on the screen. This is one of mine and Carrie's favorite. We use this a lot. Rebecca Rosenblatt said, all wounds can be healed, but you have to be willing to go into the painful center to clean out the wound, or it will fester and keep causing pain. So, I mean, I think we all agree that that's kind of what EMDR does. It's diving into the wounds. It's like, I call it an emotional cleanse. It's like cleaning the wound out just like you would a physical wound so it could heal. But as Carrie was saying, like, it's like before I send a client to do EMDR, I kind of prep them for it. You know, there's a lot of trauma stuff that I want to do with them first. Instead of just sending them in cold turkey. So what would you recommend, like if someone watching this is considering trauma treatment, like how would they know they're ready for EMDR?
I think obviously the best way is talking to a licensed professional who's familiar, just to know the creator of the whole idea of EMDR, has put out a clinical book that's hard for people to read who aren't real interested in therapy. But she's also put out a book called Getting Past Your Past, and that's one thing that is really helpful because it kind of leads you through where this is applicable, and it's more of a layperson's way of talking about things instead of all the clinical terms that come in the other book that she's got. So I think that would be the place to start if you're not already in therapy with somebody that you can talk to about, is this something that would help me, then that book can give you some guidance.
So what you're saying basically though is that the best move is to go ahead and start with a therapist and kind of get your therapy going and kind of rely on them to let you know maybe now's time.
Yeah, and even if you start with an EMDR practitioner, the first stage is history taking, and that may be one session or it may be 5, 6, 7, 10, 12 sessions. It just kind of depends on where they're at, and like you talked about, if they've got the resources or the safety, what they can work through some talk therapy and that sort of thing. So just even being in a place to begin processing makes a difference.
And what I'm hearing you say too is, of course, you're constantly assessing that too.
Absolutely.
Are they ready in the history taking?
Absolutely.
Right, and that you will advise them to continue or pause or
That's
whatever.
the first step, and then step 2 of the treatment process is resourcing. So we build resources, and if I give resources and they're still not in a place where those are helping, we'll keep building resources, and then we'll keep doing whatever we can to get them in a safe spot. Before we ever start phase 3, which is where you actually start the targeting and moving on through the deprocessing or reprocessing.
So we've talked about that it's effective. How long does it last?
Yeah, that's a great question, because it seems like when something happens fast, it goes away fast a lot of times. And so the good news is they've done research studies at all kinds of different stages. So they've done 3 months follow-up, 5 months follow-up, 9 months, 15 months, and I think even up to 5 years. And people reported at like 80 to 90% still experiencing the positive effects of the treatment. And so not having those disturbing thoughts or nightmares or body sensations or anxiety or whatever was coming along with it. And so retention is huge. It's a big deal, and it's a big part of this process. So
that's amazing.
I wouldn't believe in it if I didn't see that.
Right.
If it was something I had to redo every 9 months to a year, I'd say let's find something else that works.
Sure. And I was at a training last week, and the Department of Veteran Affairs has done replicated several studies with their population who've experienced wartime trauma, and it's their recommended treatment. So we have a lot of research from a lot of different places, right, and speaking, and they were speaking too that they will continue to make it their preferred treatment because it lasts, because of the lasting effects.
Yeah, absolutely.
But before we exit here, let me just remind everybody to go check out greenshoe.org, and their organization doing intensive outpatient with trauma treatment. Also, make sure you check out Derek's website, justicestepcounseling.com, where you can access his services or just read some of his blogs or some of the things that he's doing there. But next week, not next week, in 2 weeks, we will be having Rob Weiss, who's going to remote in. And we're going to be talking to him about, is technology the devil? I really,
ironic with him remoting in.
Yeah.
Yes, interesting. Yes,
That's true.
That's true.
Yeah. So obviously, he probably doesn't think it's the devil.
Spoiler alert.
Yeah, a little spoiler there. Thank you, Derek, for ruining our next show.
Sorry. Watch anyway. I'm sure
Watch
it'll be great.
anyway. Right. Yeah.
But it should be really fantastic. We're going to talk about concerns parents have.
Sure.
We're going to talk about concerns people have that are in recovery, who are, because a lot of times in addiction, tech is being used pretty heavily, especially the type of work we're doing as sex addiction therapists. So he's going to talk about all that, and I can't wait to have him on the show.
Right.
So we will see everybody back here in 2 weeks, except for you.
Right.
We'll see. You can join us online.
There you go.
Yes, there we go. Thank you.
Thanks again, Derek, for joining us on Recovery TV Live. And for those of you watching, if you found this information to be informative, please subscribe to our channel and don't forget to click that bell so you will be notified as we post more informative videos. Hey, and if you want to join in on the live discussions, go to our Facebook page and like our page and find those Recovery TV Live events and like those events. And don't forget to follow us on Instagram and Twitter, and I'll make sure I put a link to all our social media and websites in the description of this video below. Thanks again for being with us, and I'll see you back here next time.